The prevalence of nicotine usage in the United States, primarily via traditional tobacco cigarette smoking, was on an upward trajectory until the 1964 Surgeon General's Report on Smoking and Health. Since then, widespread public health campaigns, state and federal legislation, advertising bans, and increased taxation led to a steady decline in nicotine usage. An abrupt change in this trajectory occurred when commercially available e-cigarettes entered the market in 2007. Exploiting loopholes in the Public Health Cigarette Smoking Act, aka the broadcast ban, manufacturers marketed their products as cheaper, more flavorful, less harmful, and useful as smoking cessation aids. Between 2011 and 2018, there was a progressive decline in the percentage of high school students using traditional cigarettes. However, it was accompanied by a reverse trend of increasing e-cigarette usage. An estimated 20% of high school students were using e-cigarettes in 2018, prompting the Surgeon General to declare e-cigarette usage among youth as an epidemic. There exist major knowledge gaps regarding the adverse perinatal outcomes of e-cigarette usage during pregnancy. One of the largest data sets comes from the Phase 8 survey of the Pregnancy Risk Assessment Monitoring System, PRAMS, between 2016 and 2018, which included data from over 55,000 pregnant persons. Analyzing the PRAM data found that traditional and e-cigarette exposure during pregnancy has increased odds ratio for three of the same adverse outcomes: SGA, birth weight less than 2,500 grams, and spontaneous preterm birth under 37 weeks when compared to non-smokers. However, it's notable that there was no statistically significant difference between outcomes for e-cigarettes versus traditional tobacco smokers. A study performed in Oklahoma and Texas in 2015 found that 7% of pregnant persons reported e-cigarette usage shortly before, during, or after pregnancy. Examining factors associated with e-cigarette usage, a 2017 survey found that 75% of e-cigarette users switched to e-cigarettes from traditional cigarettes when they learned they were pregnant. Animal research has found that fetuses exposed to e-cigarette vaping in utero have altered global DNA methylation, altered transcriptomes, increased inflammatory markers, altered metabolic pathways, as well as structural and functional pulmonary and cardiovascular changes. E-cigarettes are sold in a variety of shapes and sizes, but their basic engineering principles are similar and consist of a chamber with a nicotine delivery liquid, a heating coil, a vaporizing chamber, air intake, and an aerosol outlet. The nicotine delivery liquid in e-cigarettes is called the juice and is comprised of varying ratios of propylene glycol and vegetable glycerin, with nicotine and, if desired, flavorings. Flavorings were not FDA regulated until 2016 and varied widely in their ingredients. The passive, fully dilated diameter of the human uterine artery is approximately doubled. This enlargement in arterial caliber occurs with outward hypertrophy of the vascular wall, in comparison to the eutrophic hypertrophy of hypertension or the inward hypertrophy of atherosclerosis. Similar changes are found in rodents, making them ideal research models. As can be seen in these graphics, the human and rodent uteri are structurally different. The rodent uterus has two horns. Here you can see one horn with 9 feti and their respective placentas. Below is the uterine artery with branching arcuate and radial arteries. In pregnancy, there is increased uterine artery expression and activity of prostacyclin, nitric oxide, and endothelium-derived hyperpolarizing factor. Endothelial nitric oxide synthase is preferentially expressed in the uterine artery during pregnancy. On the right, you can see the expression of eNOS protein compared to the omental artery as a control. We hypothesized that e-cigarette vaping during pregnancy will result in endothelium-dependent uterine artery dysfunction mediated by the nitric oxide system. A custom-engineered vaping system with precision-controlled aerosol release technology, was used to replicate the latest generation of e-cigarette atomizers currently on the market. Pregnant rats were exposed to e-cigarette aerosols using airtight chambers with unidirectional flow, 3 hours a day, 5 days a week. Rats were sacrificed on gestational day 20 in the first cohort and 21 in the second. Term pregnancy is 21 to 23 days in rats. The uterine arteries were harvested and cleaned and mounted onto pressure myograph using sutures. The pressure myograph maintained physiologic conditions with a pressure of 90 millimeters mercury. Uterine artery lumen and outer diameter were measured with an optical camera. A maximally vasoconstricted uterine artery is shown here. Note how wide the gates were prior to constriction with thromboxane. After maximum vasoconstriction, serial, threefold increasing concentrations of acetylcholine were dosed to sequentially vasodilate the vessels. Once at maximal dilation, the eNOS pathway was blocked using L-NAME, a nitric oxide synthase inhibitor. The percent change from maximal dilation was measured and demonstrates the nitric oxide component of vasodilation. 3 ingredients were vaporized, and mass spectrometry identified numerous byproducts in the e-cigarette chamber. Rat serum nicotine concentrations peaked 3 to 6 hours after the start of exposure and matched nicotine concentrations found in moderate to heavy smokers. This was the rationale behind choosing e-cigarette vaping exposures of 3 hours a day. Maternal weight was not altered throughout pregnancy, and the nicotine animals were pair-fed so that they received identical nutrition as the controls. The first group of rats were sacrificed on gestational day 20, and a statistically significant progressive decrease in fetal weight and crown rump length was noted from unexposed controls and juice plus nicotine. A second group of rats were allowed to deliver spontaneously, and neonatal weight and crown rump length were tracked until postnatal day 10. The pair-fed juice and controls had similar postnatal growth trajectories, while the slope of the growth curve for juice plus nicotine was diminished. Having a gestational length of 21 to 23 days, 1 day of rat pregnancy is equivalent to almost 2 weeks of human pregnancy. As we had no cases of preterm delivery in the gestational day 20 group, the third group was carried until gestational day 21 in order to expand the duration of e-cigarette exposure. Again, we had no cases of preterm delivery, and the findings were equivalent to the first group's results. This cohort, however, had a very statistically significant difference in placental weight between controls and the juice plus nicotine group. On gestational day 20, maternal and fetal heart rates were not statistically different. Ultrasound Doppler interrogation of the maternal uterine and fetal umbilical arteries were performed. Cross-sectional diameters were measured to estimate flow in milliliters per second. The uterine and umbilical artery estimated flow patterns mimicked the fetal weight, crown rump length, and placental weights, with juice and nicotine groups with the lowest flow rate. Here are dose response curves for 2 uterine arteries. On top is the control, and on bottom, e-cigarette. The basal diameter and acetylcholine stimulated response were significantly lower in the e-cigarette group compared to the controls. The magnitude of difference between the control and L-NAME maximum percent dilation demonstrates the nitric oxide component in the e-cigarette induced functional deficit. Note the lower maximal dilation of the e-cig group prior to L-NAME administration, demonstrating a baseline functional deficit in this group. Phosphoserine 1177 eNOS is the most prominent excitatory phosphorylation site, and it was significantly decreased in the e-cigarette groups compared to the controls. As you can see in the right panel, this was accompanied by a concomitant decrease in the total eNOS expression, which is the rate-limiting enzyme for the endothelial-derived dilator nitric oxide. Interestingly, note the decrease in the juice alone group between phospho and total eNOS. This is the first study to demonstrate in vivo that e-cigarette aerosol exposure during pregnancy disrupts the endothelial nitric oxide mediated vasodilation of the uterine artery. 3 fundamental outcomes can be garnered from this study. 1. During pregnancy, e-cig aerosol exposure significantly attenuates agonist-induced vascular reactivity in a rat uterine artery at physiologic pressures of 90 millimeters of mercury. 2. E-cig aerosol exposure disrupts uterine artery vasodilation via the eNOS pathway. And 3. E-cig aerosol exposure decreases levels of excitatory, post-translational modification, and protein expression of eNOS in the rat maternal uterine artery.